Oh, it's gonna be fun tonight. We haven't gone out dancing for a while. You're lucky, Jessica. Chewy's so cute and so nice to you.
Well, so is David, don't you think?
Yeah, but we're not serious like you and Chewy.
Yeah, I know, but speaking of something serious, I need to start using birth control pills.
But you and Chewy have been doing it for a long time. Don't tell me you haven't been using protection. At least condoms. Look, besides getting pregnant, you could get an infection or something.
Yeah, we use condoms most of the time. I guess we've been lucky, but I need to start taking birth control pills, just in case.
Yeah, so what clinic are you going to?
No, I don't want an exam from a doctor. I think I'll go over to Juarez and get pills or have them give me a shot. What do you think?
But why don't you want to see a doctor?
You know, because they'd want to check me down there. How embarrassing. No way.
Well, yeah, I've been checked.
You? Really? Why would you need that test? I didn't think you had gone all the way.
Well, I haven't slept with anyone yet. But it is still important to check your health. It's a basic exam. You've never had a pap test?
What's a pap test?
A pap test is an examination to check for abnormal cells in the cervix. The cervix is a lower part of the uterus connected to the inside of the vagina. Cancer can develop in this area, and this is known as cervical cancer or cancer of the cervix. Cervical cancer can take many years to develop. First, healthy cells begin to change and become abnormal. Over time, these abnormal cells can eventually become cancerous. For this reason, it is important for all women to have pap tests regularly.
First, I called the clinic to make an appointment for the pap exam. When I arrived at the clinic, they took me to an exam room, and then the doctor came in and talked to me. She explained how she was going to do the exam. Then she left so that I could change into a paper gown. Once I was undressed, I laid down on the exam table. When the doctor returned to the room, she came in with a nurse who stayed there during the exam. The doctor asked me to put my feet in the exam table stirrups to support my legs. Then she introduced the speculum into my vagina. She told me that this would keep the vaginal canal open in order to see the cervix. She also said that I should relax so that the exam would be easier and more comfortable for me. I took a deep breath, and this helped me relax. Then the doctor took a sample and gently removed the speculum. Then, with 2 fingers in my vagina, she examined my abdomen. She said this would help her feel the uterus and ovaries and make sure that everything was all right. And that was it. The doctor said she was happy that I had come for my annual pap exam. She also said that I shouldn't forget to return. I got dressed, and I went to the mall to buy a gift for myself for taking care of my health. In 2 weeks, I received a letter from the clinic saying that everything was fine.
Doesn't it hurt?
No, it didn't hurt me, but every woman can have different sensations. It's a little bit embarrassing, but...
I still don't understand. Why do I need this exam?
Every day in the U.S., 35 women are diagnosed with cervical cancer. And every day, 12 women will die from it. A pap test can discover cancer early when it can be easily treated. When cancer is found early or localized, the number of women surviving 5 years is much higher than if it is diagnosed late or in distant stages. A pap test can also identify changes in the cells before they turn into cancer. These cells can then be treated and cancer prevented.
Girls, the boys just called. They said they're going to be a little late. They had to get gas.
Mom, come in. We want to talk to you. My mom is a health promoter, so she can explain pap tests to us.
Oh, yes, it's very important.
But why? I'm a clean person. I have good feminine hygiene. I don't think I've had any kind of infection before.
Well, many cervical cancers are caused by a virus called human papillomavirus, or HPV.
Human papillomavirus, or HPV infection, is very common in both men and women and is spread by sexual or intimate skin-to-skin contact. You are at greater risk of HPV infection if you had sex at an early age, have had multiple sexual partners, or are with someone who has had multiple sexual partners. Some types of HPV can cause cancer of the cervix, vagina, and vulva in women, and cancer of the penis in men. In both men and women, the virus can cause cancer of the mouth, throat, and anus. The good news is that high-risk cancer-causing types of HPV can now be prevented with a vaccine. It is recommended in girls and boys aged 9 to 12. For adolescents and young adults who have not yet received the vaccination, it is recommended up to the age of 21 for men and to the age of 26 for women.
But Mom, Jessica uses condoms. Doesn't that protect against sexually transmitted diseases, including HPV?
Well, it's important to use condoms because they do offer protection against many STDs. Unfortunately, it's fairly easy to get HPV, and condoms don't offer full protection.
Well, but Chewy is my first.
What if he's had other partners who infected him and he just doesn't know it? Anyway, even young women who are virgins should be examined.
Oh my God. Did you say virgins should get exams?
Sit down, ma'am.
How is it possible? Won't that take away their virginity?
No, the tissue or the hymen doesn't completely cover the vaginal opening. Otherwise, girls and young women wouldn't be able to have a period. The doctor is able to do a pap test and pelvic exam without hurting her.
Yeah, Grandma. I've had a pap test.
Ay, Leticia, why did you let Alisa get an exam? She's too young. And there's no cervical cancer in our family.
Well, having cancer in the family is a risk, but many people get cancer even if no one in their family has had it.
The more you worry, the sicker you get.
Like the saying goes, better to be safe than sorry. In the case of cervical cancer, it's important to have regular exams to prevent cancer.
But Mom, how's that possible? I thought the pap test just found cancer when it was already there.
Well, it can find cancer when it's already there, but often the test can find abnormal changes in the cervix before they develop into cancer. And usually those can be treated. On the other hand, Alyssa, you're right. The test can find cancer, and if it's found early, it can be cured.
Yeah, but doesn't cancer just happen to old people?
While age is a factor, everyone is at risk. There are other factors. In the U.S., most women diagnosed with cervical cancer are between the ages of 35 and 54. Infection with a high-risk HPV type puts you at higher risk of developing cervical cancer. Early-age sexual activity, having multiple partners, or being with a partner who had or has multiple partners increases your risk. If you are a smoker, your risk of cervical cancer doubles. Women who have had more than 3 full-term pregnancies and women who become pregnant under age 17 are at higher risk. Most women who get cervical cancer do not have a family history of cancer. But if your mother or sister had cervical cancer, the likelihood of you developing it can triple. Screening for cervical cancer is particularly important in this region because Hispanic women, women living in rural areas, and women living on the border have higher rates of this type of cancer.
Well, I haven't had a pap test in a long time. I put all my faith in God. If I get cancer, it's because it's God's will, and it's my time to die.
Oh, Mom, it's good to have faith in God. But didn't God give us doctors and people who can do exams so that we can be healthy?
I don't need a pap test. I had kids a long time ago. Anyway, your father passed on years ago. Why do I need this exam? If I don't have sex, I have good feminine hygiene, and I eat healthy foods, so I don't think I'll have any problems. Besides, I don't have papers. They won't take me in the clinic.
Mom, even women who have had babies and are no longer sexually active should be checked regularly. Some women have been infected for many years without knowing it until cervical cancer develops. Also, there are cancers that happen without infection or any other symptoms. In terms of papers, that's no excuse. You can get medical attention without being a U.S. citizen. Clinics only ask for proof of residency and that you live near the service area of the clinic, but this doesn't mean that you need a passport or to be a citizen. Mom, I can help you clarify which papers you need in order to go to the clinic.
Thanks. But if a woman has this virus or a vaginal infection, won't she know that something is wrong? I suppose that when she has these symptoms, that's when she needs the exam.
The problem is there are usually no symptoms for early-stage cervical cancer, or HPV. That's the dangerous thing about cervical cancer. By the time there are symptoms, it can be very advanced. That's why we recommend women get pap tests regularly, even when they think everything's okay. Because if we find cervical cancer early, it's curable.
Do you think cervical cancer is as serious as other kinds of cancer?
That's a good question. This type of cancer can be very serious. But if it's caught in time, it can be curable.
I'm embarrassed to get the exam. I'm sure it will hurt, and I don't know where to go.
Don't be dramatic. It doesn't hurt. It can be a little embarrassing and uncomfortable, but it's worth it to know that you're healthy. There are lots of places you can go. Don't make excuses, please.
But doesn't the pap test cost a lot?
Well,
Many clinics have a sliding scale fee, so you don't have to pay very much if you don't have much money.
But if I go to a clinic, everyone will think I'm having sex. What if my mom or my aunt drives by and see me?
Well, it's true that a lot of people in the community can think like that, but it's more important to be examined regularly without caring what others think.
I don't know. Chewy's very jealous. I don't know if he would want anyone to touch me down there, especially if it's a male doctor.
Jessica, you can ask for a female doctor or a nurse. But men need to understand that women's health is very important. After all, if we're not healthy, who's going to take care of them?
Yeah, they're helpless without us, poor things.
But what if there's a problem that comes back from the pap test results? Will I need an operation, or what will happen to me if I can't have children?
I don't think you would need surgery. Usually early changes and even early cancer can be treated without surgery. For some women with more advanced cancer, surgery might be necessary. The important thing is to be checked now so that any problems will be found early.
Yes, but is the test accurate? What if it says that everything is okay and it's not?
The test is good. Of course, mistakes are possible. That's why it's important to have regular checkups from head to toe, including pap tests.
Let's see, what is regular? How often should I be checked?
Women aged 21 to 65 should have a pap test every 3 years. Women 30 to 65 have the option of getting tested every 5 years if they include HPV testing. Women who have had a hysterectomy should talk to their doctor about whether they need a pap test. To help prevent cervical cancer, you can limit your number of sexual partners, practice safe sex, eliminate smoking, and the most important thing you can do is to have pap tests regularly.
I can't promise that I'll go to the exam. I work full-time, and the truth is, I don't have time to go to the clinic.
Ay, there are clinics that are open in the evenings and even on Saturdays. So don't make excuses.
All right, I'll call and make an appointment. Alyssa, will you come with me?
Of course. That's what friends are for.
Well, okay. I guess if Jessica's going to have a pap test, I ought to go too. Letty, can you help me make an appointment?
Of course, Mom.
We're coming!
Just a minute, guys.
I'm glad we were able to talk about this. If you have any questions, you can confide in me. It's very important to take care of our health. As mothers, grandmothers, daughters, and sisters, we women have the responsibility to take care of ourselves, our families, and our community.
Let's go.
Girls, God bless you. Be careful.
Thank you.
Thank you.
Bye, Mommy.
Bye. God bless you.
Go ahead.
Goodbye, sweetie.
Bye, Grandma.
Hello, I am Yvette. If it weren't for the PAP exams, I wouldn't be here talking to you today. I was young and I thought I was immortal. Fortunately, I went to my PAP exams and they detected cervical cancer early. I can't stress enough the importance of these exams. Visit your healthcare provider and have your exam. It's a little time that could save your life.